I think that it would be great to have every kid who has a diagnosis of autism have a developmental optometrist assess them, because they are really trained to understand what could come up and look for those specific things that most optometrists don't understand. Most developmental optometrists have a pretty good understanding. There's a lot of discussion in our community about the connection between autism and vision. So a good developmental optometrist should be well versed on the topic. There's, of course, a wide range with kids who are on the autism spectrum, and I have one, so I also know a little bit about what that entails. There's some patients who will have some mild issues, and a lot of that comes under the umbrella of sensory integration, right? They have a hard time using two senses at once, or they might have an aversion to using a sense. And when it comes to vision, if you have an aversion to using your vision, and these children will often have an aversion to central fixation. So they are using their side vision sometimes. And I have to go sometimes on all of this. Every single kiddo is so different, but they will sometimes use their peripheral vision and not look at things directly. So they'll have great peripheral vision, but really do not use their central vision well, which means they have poor tracking, poor focusing, poor teaming. All those skills are underdeveloped because they're not being used. They have a hard time using their vision while something's going on auditory. They switch between one or the other. So these are all things that we can work on in vision therapy. It's so much fun to work on. And we're just really like working on getting their brain to connect, getting their vision to develop. Sometimes they benefit from glasses in a way that other kids might not need this prescription. These kids really benefit from the prescription. Low prescriptions, prism prescriptions, they can really change how they see the world. They can change their posture, they can change their eye contact, and it's different for every kid. But it's really fun to be able to find something that kind of clicks and unlocks their world when we do the exam. And people think, oh, the sensory issues, they're not going to wear the glasses. Like, we're only going to prescribe them if they make a significant improvement. And so usually by the time we do find something that does work, the kids put them on, and often they don't want to take them off. Like, they're on their face all day. They'll fall asleep in them. So not every time, of course, but it's really fun when we do see that they really change how their whole brain is processing the world, because now they can take it in. It's change it in a way that they can take in the information. It's not overwhelming. They can look at it centrally as opposed to just having it be a side vision usage.
So eye contact is, or poor eye contact is one of the characteristics of associated with autism. So what I think I'm hearing you saying is if a child has been diagnosed with autism and makes poor eye contact, maybe don't write that off completely as due to, a trait of autism, that there might be vision issues going on as well.
Somewhat. I mean, it's certainly like the autism causes them to not want to use their central vision. And so they have a hard time looking at things centrally, whether it's a person or looking at their paper. Using their central vision is effort, and it doesn't work well with other senses. So you're going to see it as avoidance of eye contact, but really it's avoidance of central fixation, and it's avoidance of using their central visual attention. They're using peripheral vision, and they're using hearing and vision together with their side vision. But side vision is great. Like, we definitely need it. We do a lot with peripheral vision, but if you are not using your central vision, there's a whole bunch of skills that aren't developing. And so it's connected to the autism, but then you have a whole bunch of downstream effects. So once you start to work on the eye contact, that's great. Well, they still have poor tracking skills. They still have poor depth perception. They still have poor convergence. And so when something's coming at them, they don't know where it is in space. That's why they use their side vision. So that's something else that people might see. That's one of the ways that I've had a few young ones refer to me lately, is the OT notice that when something was coming at them, when a ball was coming at them, they were really delayed, or they avoided looking at the ball coming at them. And that was a sign for them that they're not using their vision, which was spot on.
That is really interesting. What about glare sensitivity? You want to talk about that?
Well, I want to talk about that and also segue into visual snow syndrome. So there's a lot of patients who have sensitivity to light, and I think that's what you're asking about with glare sensitivity. right? Sensitivity to light.
I think so.
Yeah.
Tell me if I'm wrong.
Well, I mean, some kids will feel like the black and white contrast of print on a page is too much for them. And that's one of the initial red flags that they might have visual snow syndrome. Now, visual snow syndrome is a condition that affects 2 to 3% of the population. That's a lot of people, and it has been missed a lot. And certainly it's more often to come up post-concussion. There's a lot of kids, though, are missed because they can't describe what they're seeing as well. There's, if you want to know more about it, go to visualsnowinitiative.com or .org. They have a fantastic website with all kinds of research, and they'll talk about what it is. It's basically when there's static in your vision or floaters in your vision. But with kids, they might only have like really persistent after images or colored spots or black dots. And those kids also tend to have light sensitivity. They do not like to look at the page. So you'll see avoidance. They don't know they don't not telling you any of those symptoms I just listed. They just avoid. And what we do for them is we have colored filters that we can put over the page, and that helps them a lot. Sometimes we put the tint in their glasses. We fix any visual efficiency problems they have, and we see that those symptoms diminish. So any kid who has light sensitivity or prefers to have their worksheets printed on colored paper or seems to just avoid the bright black and white contrast, that's a bit of a red flag for visual snow syndrome.
You might have mentioned this earlier, but in the research or in your clinical observations, is there a higher incidence of vision problems in individuals with autism spectrum disorder?
Yes, yeah, they are definitely have a higher incidence of vision problems. It could be any type of vision issues, so that could be as simple as the tracking, teaming, focusing type, or eye turns, lazy eye, which is also called amblyopia, visual perceptual issues also are a higher incidence. So across the board, it's going to present differently in different individuals, but definitely I think that it would be great to have every kid who has a diagnosis of autism have a developmental optometrist assess them, because they are really trained to understand what could come up and look for those specific things that most optometrists don't understand. Most developmental optometrists have a pretty good understanding. There's a lot of discussion in our community about the connection between autism and vision. So a good developmental optometrist should be well-versed on the topic.
All right. For listeners who want to connect with your practice, Denver Vision Therapy, or with you, or to find out more about your services, where can they find you?
So probably the best place is at our website, which is denvervt.com. And we do try to have a lot of information on there. I really love to educate. So we've put a lot of articles on there about different vision problems. There's the symptom survey, there's research articles, there's a lot of resources there. And you can also text our office, which is a cool feature, or you can just contact us on the contact us form. And the front desk, really, we try to keep up really well with that, getting back to people quickly.
It's been a pleasure talking with you. Thank you so much.
You're welcome. Thanks for having me.
That's it from us today. As always, you can find more information as well as resources on our website, individualmatters.org. We hope you'll join us at the next podcast, where we'll continue to explore topics around successful living, learning and education, and child development, and share ways to help you live a more positive and fulfilling life.
The preceding information is not intended to provide or serve as medical, clinical, or educational advice. Individual Matters is not responsible for the accuracy of guest statements. All information should be validated independently. Please consult with your doctor, mental health provider, attorney, or other appropriate professionals before making any personal decisions for yourself or those in your care.